So here is a quick overview about the implementation process of clinical practice guidelines or clinical decision support tools based on Handbook 12. Handbook 12 has 50 pages and a lot of references within the handbooks. And as I mentioned before, it was developed for our colleagues from EACS. And I have to synthesize the information in 3 slides. So just take it as an overview, please. And I hope it could be helpful in terms of engage you to with the whole handbook and to develop further work. You can see 6 phases or objectives on the top and below the expected results for each of the above. Phase 1 would be the selection of the CPG or CDT to implement. There are 2 types of CPG or CDTs that can be considered for implementations, new ones, new clinical practice guidelines or clinical decision support tool, or existing, actual existing CPG or CDT. In any case, the main criterion for selecting one of those to implement is that it covers the need that has been identified by the ERN, the working group, or whoever who is developing the text or the tool. Once there is a CPG or CDT to be implemented, it should be important the constitution of the implementation group in order to proceed with phase 2 that will consist in planning the implementation. The result of this phase will be the scope of the implementation. It means the establishment of the extent of the implementation, including the target patients, the profile of the professionals, the care levels involved in the intervention, and the geographical area covered, which is important. Also, by the end of this phase, the stakeholders should be identified, classified, and according to their potential in order the influence in the development of the implementation and their support and strategies to engage them. Phase 3 would be the analysis of the context. The result of this phase shall be the assessment framework. That is a pragmatic method that will be used initially within the baseline assessment phase and will be the basis for the implementation monitoring and subsequent full deployment, including a structure, process, and outcome indicators. Another result is the resources needed. The required structure and actions for the implementations are identified and quantified. Examples of a structure are material, human resources, systems to collect information of the implementation process, financing, or means to incorporate new elements or health technologies, etc. And examples of actions are training, dissemination of professional material, feedback, reminders, and so on. The third result shall be the strategy to address barrier and facilitators. That is the identification of factors that could be barrier or facilitator. And once identified, it should be interesting to analyze the strategies to tackle the existing barriers and to foster facilitators. Phase 4 is the design of the intervention, and the results are the tasks and roles of those conducting the intervention in a detailed way. Any support activities are arranged, like training, dissemination, community activities, and other support activities. As a result of this phase, also it is designed the assessment strategy to capture the effects of the implementation activities on the different stakeholders involved, their attitudes and impact on the healthcare system and patients. As a result, also, the results from the small test on implementation, small test or a pilot. Maybe you're more familiar with the word pilot. It is gathered and analyzed to ascertain whether the resources are adequate, the adherence to the intervention, and the strong points or weaknesses of it. Then in phase 5, the design of the implementation roadmap and to have it develop as a result. In this slide, so the differentiation of the roadmap. And last but not least, phase 6, with the continuous improvement and the different improvement cycles as a result, in order to ensure the intervention will be regularly revisited to ensure it stays meaningful with regards to the need that motivated implementation in the first place. So please move to next. I have mentioned about the roadmap, and there's different sections for it to be the background. The questions to be considered in this section, the background, are: what motivates implementation? What justifies the need for implementing these interventions? How is this currently being addressed? What gaps there are there? What needs to be improved? The following section will be the objectives. What is the objective of implementation? What outcomes have to be achieved? What specific changes are desired in the short, medium, and long term? In the section activities or expected outputs, what will be done to achieve the objectives? Who will be the target patients? Where it will be done? When and how often will it be done? The resources or inputs should be answered to the question: what resources will be provided to perform the activities, the assessment, and the follow-up? And the assessment and follow-up include the specific indicators that will be used to monitor the achievement of the objectives. Next, please. If clinical practical guidelines or clinical decision support tools is not being implemented as intended, or is being implemented as intended, but not producing the desired outcomes, then improvement cycles can be used to support a continuous improvement until the whole change is implemented. So we have an objective, are we achieving it or not? In case not, so we will have to improve it throughout the cycles, or that can be helpful for this objective. So just for finishing this presentation, I show you here a commonly used model referred in the handbook 12, that consists of a logical sequence of 4 repetitive steps for continuous improvement, specific activities, and recommendations. The method is the plan, do, study, act, where plan means to define the objectives, questions, and predictors, to plan to answer the question who, what, where, when, plan data collection to answer the above question. So it is important to plan. Then to do. What does it mean? To carry out the plan, collect the data, and begin the analysis of the data. Study, the study phase or study stage. Complete the analysis of the data, compare data to predictors, summarize what was learned, and act. Plan the next cycle, decide whether the change will be implemented. Those aspects will contribute to the continuous improvement or evaluation. So we have to evaluate, to assess, and then to try to do our best to improve continuously.